Hi guys, this is Dr. Roberts and welcome to Sepsis 101 Real Talk with Dr. Roberts. Let's talk about today's whisper. Now let me tell you about Mama. Mama was from the South, and if you grew up in a house like hers, you already know. Mama was up before the roosters even thought about crowing. And I'm not talking about pouring some cereal in a bowl. I'm talking about breakfast. Eggs, grits, biscuits, maybe bacon or sausage. And you know coffee is already going. The kitchen is already warm. And by the time everybody else woke up, Mama had already been up. This was Mama's normal. And Mama wasn't someone who sat around all day either. She was a homemaker. She kept her house. She knew what everybody was doing in church. Don't play with Mama and her church. Bible study, women's ministry, church activities. If somebody needed something organized, Mama was probably somewhere in the middle of it. That's Mama's normal. But one morning, her daughter woke up, and the house felt different. No pans, no pots clinging, no cabinet doors, no smell coming from the kitchen, nothing, right? The kitchen was quiet. Would you have noticed? Don't answer yet. Don't answer yet. Her daughter went to check on her. Mama was awake, talking. She knew exactly where she was. Her daughter said, "Mama, you're not cooking?" And Mama said, "Not this morning, baby. I'm tired." Well, Mama does a lot. Maybe she's finally taking a morning off. Mama eventually got dressed, but breakfast, she didn't want it. "My stomach's just a little off," she says. Later, somebody from the church called. There was something Mama was supposed to help with that afternoon. Mama said, "I think I'm going to stay home today." Now wait a minute. Mama? Skipping church? Activities? But she really was talking normally. She wasn't confused. She wasn't unconscious. And every little thing had an explanation. Tired. She does too much. No breakfast. Her stomach was upset. Staying home. Maybe she finally decided to rest. So if I had handed you a sepsis poster right now, what symptom would you be looking for? Don't answer yet. Later that day, her daughter noticed Mama had really moved from her chair. When Mama finally stood up, she stopped for a second and she held on to that chair. "Mama, are you okay?" "I'm fine, baby." But her daughter kept looking because Mama was saying she was fine while her day was saying something else. Now, did you catch that trap? It wasn't one bad explanation. It was a collection of personally perfect, reasonable explanations. Tired, upset stomach, needs a day off, getting older. And one of those things could have been true. But the certainty trap happens when your explanation becomes so comfortable that we stop asking whether it fits the changing story. But Mama's daughter knew something we didn't. She knew Mama. Now let's go back. Don't look for one symptom. Look at her day. No breakfast, quiet kitchen, skipping her church activities, stayed in the chair, needed to steady herself. Now ask again. What changed? And then her daughter noticed something else. Mama was breathing a little faster than usual, taking one slight, deeper breath. Not gasping, not saying, "I can't breathe," just different. Her daughter asked, "Mama, you've been coughing." Mom brushed it off, "Just a little cold." But this time, her daughter didn't explain that clue away. She stopped looking at each piece separately and started looking at Mama, because her daughter got Mama evaluated. Mama had pneumonia, and that infection had progressed to sepsis. There it is. The quiet kitchen wasn't the diagnosis. Missing church wasn't the diagnosis. Not wanting breakfast wasn't the diagnosis. They were the changes in a person whose infection was more becoming serious. Now think about this. If you were waiting for Mama to look like someone else's sepsis poster, how long would you have waited? That's what I want my patients, families, and communities to remember. Sepsis doesn't always hand everybody the same story. One person may have a fever and another may not. One person may become confused. Another may still be sitting there talking with you. So don't wait for the person you love to look exactly like someone else's sepsis story. Know they're normal. Know what morning sounds like in their house. Know what they normally eat. Know where they normally go. Know what they normally enjoy. And know how they normally move and interact. Because sometimes the whisper is something that stopped happening. And a new worsening change, particularly when an infection could be a part of the picture, deserves attention. And for my clinicians, don't underestimate the family member who tells you she's just not herself. That's not a diagnosis, but it is the information about baseline. What changed? When did it change? What is her baseline? How is she responding? What is the trajectory going? Does my original explanation still fit? Because treatment tells us what we did, and the trajectory tells us what the patient did with it. And when the pieces don't fit, that's when I want you to take that second look. So Mama didn't announce that something was changing. Her routine did. Her kitchen got quiet. Somebody who knew her normal noticed. That's eyes of sepsis. See it? Something's changed. Question it. Don't let comfortable explain stop you from thinking. Look again. Take a second look. I want you to act. And when concern for sepsis emerges, that's where Crush 33 comes in. See it, question it, look again, and act. I am Dr. Susan Roberts, and this has been your Sepsis 101 Real Talk with Dr. Roberts. Please like, follow, and share with your loved ones and your communities. And my clinicians, share it with your teams too. And please visit eyesofsepsis.com for more sepsis education and resources. And until our next whisper, keep looking for the change, and I'll see you next time. You guys have a great evening. Peace.